Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Thanks for tuning in and welcome to this episode of Next Generation Healthcare. Today, this episode is going to be about the sickness business, what I call the sickness business, which is, there's a whole industry that's been built around us getting sick in America. And there's some problems with that industry, and we're going to try to help you understand it and learn how to deal with it. Everyone gets sick from time to time. It's not fun. But we're going to talk about the business that was built around that and curing sick and how you can protect yourself from some of the unscrupulous practices that might be in that business. It was a random circumstance in April of 2024 that I was browsing through social media and discovered Marshall Allen and his book, Never Pay the First Bill and Other Ways to Fight the Healthcare System and Win. Because the subject was so closely tied to Optimal Telehealth and what we did, I immediately got excited about it. Without hesitation, I ordered the book, and I even reached out through social media and sent Marshall a message asking him if he'd like to contact. By coincidence, we were both in the Dallas-Fort Worth market area, which was neither here nor there, but I wanted to see if I could talk to him. And there was no response, and that didn't surprise me. I'm just a small business operator out here, and Marshall's got a successful enterprise going on, so it didn't surprise me at all. But I did eventually get an answer months later from Sonja Allen, his wife, and I was really saddened and of course, surprised to find out that previous summer, Marshall had unexpectedly passed. And that was a tragic loss for somebody so young. My father died at a fairly young age, and I know what that can be like for a family. It can be pretty devastating. Sonja has graciously agreed to join us today and talk about Marshall, his book, and his substantial legacy. Before I introduce Sonja, I want to read a little about Marshall as printed on the back of his book. The book was published in 2021. Here we go. Marshall Allen is a reporter for ProPublica, where he investigates why we pay so much for health care and get so little in return. He is a Pulitzer Prize finalist and recipient of the Harvard Kennedy School's Goldsmith Prize for investigative reporting. He teaches investigative reporting at the Craig Newmark Graduate School of Journalism at the City University of New York and has spoken at various conferences across the country. Before becoming a journalist, he spent 5 years in full-time ministry, including 3 years in Kenya.
Thank you so much. I'm happy to be here.
Well, we're happy to have you. As I mentioned in my prologue, Marshall left a tremendous legacy, which you're going to carry forward. I think that's fantastic that you took that on. Can you share a little about Marshall and his motivation to write the book and commit himself to reforming the healthcare industry?
Yes, Marshall was really motivated. He had a strong justice streak. He had started covering healthcare in 2011 when we were living in Las Vegas. He was a reporter for the Las Vegas Sun, and he was asked by his editor to cover healthcare. And so as he kind of started learning about healthcare and getting interested in healthcare, he just found, especially in Las Vegas, there was just a lot of fraud and abuse happening. And his heart was always to talk about healthcare, to write about healthcare from the perspective of the patient. And so as he started to kind of uncover what was really going on and how patients were being harmed by our healthcare system, not only just in hospitals, but financially through our insurance system that we have set up. He really just became passionate about helping people. That was really the heart of his motivation for what he was doing, for how he spent his time. So it kind of grew. He covered healthcare in Las Vegas, and then we moved to New Jersey. Well, we lived in New Jersey, worked in New York at ProPublica, and continued to uncover healthcare there. He wrote a lot of really significant stories that revealed what was going on in our healthcare system, and just built an incredible network of people who were sharing these stories with him and giving him these insights. And so I think his motivation and his heart for writing the book was gathering all of these stories, experiences, this knowledge together to help people understand what's really going on, to sort of like lift up the rock and look underneath and see, the deals and the arrangements that are happening underneath the system that we don't, as consumers, we don't really see and we don't understand. He wanted to empower people to be able to control their healthcare instead of being taken advantage of and harmed by what was going on in our healthcare system.
Right. You mentioned the people all the people he met with that supported his investigative process. That's actually how I met Crystal Paulson through the book. We had her. I interviewed her on a previous episode of the podcast. She, as a patient advocate, she helped our viewers understand what patient advocacy is, and that she came to my attention through Marshall's book, and I was able to track her down. So, he had a lot of great sources.
He did.
How would you describe the impact Marshall's book had on patients in general and perhaps the healthcare industry?
I feel like probably the greatest impact has been having a resource that is able to empower, equip, and educate the people who could read the book and who engage with his material. After he wrote the book, he also created a video curriculum that essentially took the concepts of the book and boiled it down into like 16 5-minute videos. And it's really been an incredible resource. So people who read his book and who also engage with his video curriculum have taken that knowledge and been able to manage and, get help with the bills that they're having. And so from that experience, people have contacted him for help. They asked, taking these principles and these ideas that he had, and they're able to navigate their healthcare. And then he would write these stories. People would contact him with the stories of what they did, what the problem was, what they did to solve it. And he would write those up, and he called them victory stories. Anytime, someone had a problem, they would read his book, or they would, contact him using the principles that he laid out, and he would have solutions for them. And then anytime you can, advocate for yourself and get the help that you need, it's a victory. And it was really motivating to him. I mean, his whole goal was not to add to the body of intellectual knowledge, but to really genuinely have a tool that can make a difference. And so he utilized that. I feel like we've had hundreds and hundreds of stories of people who have written into him, called him, engaged with him, that have utilized his tactics and won, as he liked to say.
Yeah. Well, that's one thing that came to my attention. I mean, his background as a teacher, of course, he's an investigative journalist, helped him pull the information together and deliver it. But his background as a teacher, I mean, from the time he was in the ministry and teaching at the university in New York, he put this book together as a textbook, as a tool, and then he followed up with all the recorded material that people can subscribe to. People are so busy in today's world. I mean, there's all kinds of books that says, here's how you should eat, or here's how you should lose weight, or do this or do that. And people are so busy, they can't remember all that stuff. But Marshall had the foresight to to provide the tools necessary to make it, put it in an environment where it could actually be implemented and used on a practical basis. That was pretty cool. The book's broken into 3 parts. Can you comment, just generally, don't need to go into detail, but comment on each of these parts and describe the subjects they cover?
So I think in the first section of the book, where he really is trying to show people how to get understand what a CPT code is, understand, what questions you can ask. So if you find yourself in a situation that you're overwhelmed by a bill, or you encounter a situation where you think, oh, I don't know, how to manage this, that there's these information and tools that can help you to kind of uncover what's really going on and how to get the help that you need or how to pay the bill that you need. On the second part of the book, it's saying before you ever have a healthcare encounter, when you just even have a routine physical or just a basic bill, figure out what the goals are to say, these are the questions I'm going to ask when I make my appointment. This is how I'm going to find out the prices ahead of time if I need an elective surgery. If I need to get an image done, an MRI or a CT scan or whatever, these are the places that I can go to find that information, so that I'm not getting egregiously billed. And then it's like, well, the service has already been done. The bill is already here. And now I have to untangle, the situation. And then in the third part of the book, talking to employers, is saying our employers, I think it's 155 million Americans get their insurance through their employer. So
half of the insured people in America get their insurance through their employer. Yep.
Right. And so it's really important for employers to understand how employees can be educated to navigate their healthcare, because if employees understand how the system works, they can save a lot of money for the health plan. And so the employer ends up winning on the end, because if they can reduce the cost, if they can reduce the spend of the employees, then it saves the company a lot of money. And that's money that obviously can be spent. It can be given back to the employees. It can be, utilized in other ways. And so it's really important for employers, because they're the ones who are finding the health plan, that the company needs. And if they understand the value of it and pass that on to the employee, you can really make a difference,
right,
in your healthcare spend.
Right. I found that employers are poor shoppers of health insurance. I mean, they rely significantly, and in fact, Marshall touches on this in the book, they rely significantly on an insurance agent as their professional advisor in that space. And insurance agents have an agenda. I mean, you find some that are up and above board, but let's face it, insurance agents are paid on commissions, and they get premiums and bonuses and trips to Hawaii when they bring on new business. So it's not uncommon for an insurance agent to tell an employer every year, well, this year we're going to switch you from this company over to this company, because that generates a lot of revenue for them.
Exactly.
Mayor, we would hope that he's being sincere, and that's the best solution for the company, but may not always be the case. Marshall's years of research in healthcare industry revealed a compelling fact to me, and this is a moral or philosophical question. We'll compare our thoughts about it, perhaps, but these overcharging services in the medical industry are not clear. I mean, obviously there's some clerical errors, but this is by design. This is intentionally done to increase profit, like the upcoding process. You talked about coding and how he gets into coding in the first part of the book. This upcoding process is far too common. I just have to ask myself, in a moral society, how do you think the people actually working in healthcare justify their actions? They know what they're doing. Do you have any thoughts on that?
I think that it comes, I don't, I can't speak necessarily for their motivation, but I feel like there's a culture that says as long as you're making money, it's okay. It's a business expense. It's not illegal. You're not breaking a law.
Right.
You're utilizing the system to get as much money as you possibly can. And if you can increase the code, if you can take a procedure from, a low code to a higher code, you're going to make more money. It's kind of like, in one sense, it's like good business practice, right? If you're a business owner and you're trying to increase your profits, that's an easy way to do it. So I don't think that everybody in that industry is necessarily like knowingly trying to cheat people. I think that it's within the code of ethics or whatever for how to run a business. And so we just blindly turn an eye to the people that we're harming. Because I think the other thing that happens is that there's a disconnect. We go, I'm the consumer. I go to the doctor. I give them my insurance, and my insurance pays the bill. So it feels like I'm not really paying the bill. I'm paying my $50, but the insurance is paying the bill. And so what do I care if it gets upcoded or not? But that's short-sighted, because you're paying the bill on the backside of it. Your premiums keep going up. Your coverages keep going down. The amount of money that we have to spend for the same healthcare that we had 10 years ago is exponentially higher. So I think that the system has become so convoluted that the people who are perpetrating it are disconnected from the people utilizing it, and the people utilizing it are not aware, because they think, oh, well, all I do, I go to the doctor and I pay my $50 copay. And so it's very opaque. And so I think because of that, it's not, you don't have that sense that you're harming an individual, directly a person. It's through this big, huge system. So we can kind of hide behind these systems. And I think there needs to be a greater, degree of conscience or care for people.
I think it's I agree with what you said. First of all, it has to do with a lot of lack of understanding of the capitalistic system. Somebody has to pay the bill at the end of the day, and it always winds up being the consumer. So when expenses increase within a company, for instance, the government says we want to tax big corporations. We want large corporations to pay more taxes. Well, guess what? If that actually happens, I mean, first of all, the corporations are the main source of labor for people to earn money. But if that actually happened and those corporations pay more taxes, these corporations have to make a profit. So what do they do with that extra expense? Some people can be naive enough to think, well, they just have to absorb it. No, they're not going to absorb it. They're going to pass that on to consumers. And that's exactly what happens in the healthcare industry. When larger bills come through and the insurance company pays those bills, pardon me, they pass that on. That comes in the form of, to the consumer, in the form of higher rates, higher deductibles, higher copays, and it's all always obviously put back on the consumer. In another episode, we actually touch on this subject of upcoding in a little more detail, but just so our viewers right now can understand, you may be asking yourself, why don't the insurance companies police this upcoding process and restrict that process? Well, there's a reason, because they make more money too.
Exactly.
If you insurance companies are limited to how much or what percent of a claim they can take as profits. So if a particular medical procedure or visit occurs and it has this basic code on it that say generated a $5,000 insurance bill, and then the hospital or whatever upcodes it to a $50,000 bill, the insurance company makes the same percentage of the $5,000 as they do the $50,000. Everybody makes more money. The hospital makes more money. The insurance company makes more money. And who pays for it? The consumer.
Exactly.
So,
Marshall used to always say, if your profit margin is the same, the way to make money is just to have a bigger piece of the pie. I mean, or just have a bigger pie. I'm sorry.
Yeah,
like your piece may be the same, but 30% of $100 is a lot less than 30% of $1,000.
That's right.
So just make a bigger pie.
Yeah. It's been my experience to some extent. The government watches Medicare and Medicaid expenses a little more closely than insurance companies do, but you could understand why. Mm-hmm. Moving on, tell us a little bit about Allen Health Academy and how people can benefit by subscribing.
So Allen Health Academy is a video curriculum that is based on the book. It's 16 videos, approximately 5 minutes apiece, that walks people through the process of how to navigate your healthcare. So some of it is understanding the backstory of what's really happening, the deals that get brokered between insurance companies and providers. And part of it is when you get a bill, what do you do? How do you figure out a CPT code? How do you figure out how to, protest if you've had a denied claim? How do you figure out how to utilize hospital financial assistance programs? So it's a how-to on navigating your healthcare. And because it's divided into these 16 videos, they're short, they're easy to understand. There's links, there's information that's you can, other websites where you can find prices to compare if you need to shop for a knee replacement, say, for example. There's places where you can get the information so you have what you need in order to make those informed healthcare decisions. So on our website, allenhealthacademy.com, there's the curriculum is available there. You can sign up, you can get access to it, and it has all the information that you need right there.
That's fantastic. Referring back to the last section of the book, we talked about the employer section of the book. Can employers benefit from Allen Health Academy as well? Will it be a good tool for them?
It really will. It's also utilized, for if you're an employer and you have employees, it's people don't often want to sit and think about healthcare. When they have a problem, when they have a bill that they can't pay, that's when they go, oh, I need some help. But Marshall's promise was that you can save hundreds, if not thousands of dollars per healthcare encounter. So if employers understood that and incentivized and motivated their employees to help navigate their healthcare, then you're going to be saving a lot of money. And so it was always a desire for employers to be able to provide the curriculum for their employees, probably have to mandate that they engage with the videos, that they watch it. But it would really save the individual employee and the employer as a whole a lot of money if they were educated in it.
Right. Well, I don't know if you pointed it out before, but I'll point out the Allen Healthcare Academy is the for-profit portion of Allen's business. And when we say for-profit, I've got to tell you this is dirt cheap. It's very inexpensive to use, so it's well worth the investment, as is the book. I encourage everybody to take advantage of both. But you've got another major nonprofit project on the works and just over the horizon. So could you share a little bit about it? I know it's still in the pipeline and you're working on it. May not want to disclose everything there is to know, but give us a teaser about what's coming.
Yeah, absolutely. So just about a month prior to Marshall passing away, he found an online program where he could clone himself, and he got a kick out of that. He thought it was great. And so he downloaded 475 articles, podcasts, his book, interviews, speaking notes. He just kind of dumped his healthcare brain into this clone. It has a massive amount of information. And then he worked with it, asked it questions, came up with like top 10 questions that, people might need answers to when they're trying to navigate their healthcare. It speaks 150 languages. He recorded his voice into it so you can talk to it and he talks back to you. Obviously, you can type, write questions. It has links to other companies that, resources to help people. You can ask it to write you an email to your insurance company to fight a claim. You can, and it will write that for you. It's really, really this incredible resource. And he had really created it about a month before he passed away. So after he died, I thought, here we have this incredible resource that hasn't had the opportunity to get out into the world. And Marshall's really, his passion in life was really just to help people. He wanted to be available to people. When he would speak, he would give people his information, his email, tell them to call him. He would help them navigate their bills. And so I wanted this resource to be available for people who needed help navigating their healthcare. So we started a nonprofit. It's called Marshall Allen Project. And we have a website, marshallallenproject.org, where you can go. It's a landing page right now that kind of talks about what the clone is and the different possibilities that we have and what our heart is for helping people. Our primary goal is really, there's 100 million Americans with medical debt. So this will give them the tools that they need to be able to deal with some of that and understand, how they can get themselves out of the situation that they're in.
Yeah.
So that's what we're working on to get launched here in the new year.
Well, that's fantastic. I mean, it's, I've got it for those techies out there. I want to make it clear that this is an AI-based tool. That's what's adding that's what facilitated bringing all this information together and being able to deliver it to consumers. So it's pretty cool. I'm looking forward to trying it out. And we're going to have Sonja, when you release it, and I think you talked about releasing it sometime next year when you finish it, get it ready for market. We want to have you back on again to talk about it. And yeah, I haven't held up the book yet. I should have thought of this sooner, but this is Never Pay the First Bill. This is what the book looks like. You can find it on on Amazon and any major book outlet. So by all means, I encourage everyone to go out there and check it out. It's an easy read, and you'll be glad you did. Everybody encounters healthcare problems, and this will help you understand the process you're going through. And that's part of Optimal Telehealth's mission as well, is to support people and make them help them understand the healthcare industry and how to take care of their own healthcare, control their own healthcare without letting the insurance companies control it for you. So, do you have any parting thoughts that we haven't touched on, Sonja?
I think I want to just encourage people, like, there's a lot of stress and anxiety that people are dealing with in considering their healthcare. It's becoming an increasingly larger problem for people financially, emotionally, physically, and there are tools. There is help out there, and just want to, encourage people to take advantage of some of those tools and to know that there are people who care and who are willing to do whatever is necessary to help. That's our heart. That's our passion, is to help people. And so, yeah, I think, that's the message I want to get across.
Well, I'm certainly glad, and I'm sure everybody is glad that you're going to carry on Marshall's work. He had tremendous foresight into this subject, this topic. And as you say, it's his passion for helping people is obvious. Thanks for coming on today. It's been a great conversation, and I hope our viewers found it informative. And we look forward to having you back again in the future.
Thank you so much. I appreciate being here.
Thank you.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.